Welcome, everyone, to today's program. I am Laura Dierda, Editor-in-Chief of Becker's ASC Review. The program will begin with a presentation, and we will have a question and answer session following the completion of the presentation. You can submit any questions you have throughout the presentation by typing them into your control panel in the space labeled Enter a Question for Staff and clicking Send. Our presenters will attempt to answer as many questions as they can during the time we have, and will follow up on questions they did not have the opportunity to address. You will receive an email within about a week following the webinar that will include instructions for how you can download a copy of the presentation. You will also receive a follow-up email shortly after completion of the program. You can submit your feedback or any additional questions at that time. This email will not include the presentation. It is now my pleasure to introduce today's presenters. Tom Jacobs has served as CEO of MedHQ since its founding. He brings an enthusiasm for transforming the healthcare employment model through more effective people management. For over a decade, Tom has worked daily with ASC administrators nationwide to improve operations, reduce costs, and reduce their employer risk. His own healthcare background includes work as an ASC administrator, which helps him understand and relate to the issues facing his clients. Jay Petrick leads MedHQ's Business Development and Sales Division. Most recently, Jay was instrumental in the growth of Midwest Region HR Outsourcing and Professional Employer Organization. Prior to that, Jay was Director of Business Development of Advantech HR, and prior to that, he sold HR services on behalf of Inspirity, formerly Administaff, helping business owners discover the impact and return through outsourcing non-core functions. It is now my pleasure to turn the floor over to Tom to begin today's presentation.
Thank you, Laura. We really appreciate the introduction, and to everyone in the audience, we really appreciate you joining us to talk about HR services and outsourcing. Next slide, please. Throughout the presentation, you'll hear us talking about best practices. And I think in the promotional emails that went out for this webinar, we talked about Peter Drucker and his famous quote of never do something, or I'm paraphrasing here, but basically don't do something in your back office that someone else does in their front office. And the whole gist behind that is that, outsourcing firms hire HR professionals, HR outsourcing firms that is, and of course their growth in their career, their success in their company, the company's success really depends upon successfully performing the tasks of an HR professional, and it just optimizes that overall service. So with that, best practices in the HR realm, we feel we are always looking at ways to reduce risk, reduce expense, improve productivity by applying those best practices. Next slide, please.
Hi, this is Jay Petrick. This is one out of many. A lot of business owners, a lot of business executives have to wear a lot of different hats. You have to be a therapist. You have to be somewhat of a police officer. You have to be able to negotiate. There's so many different areas where you have to have some sort of skill, and I don't know too many business owners, managers, executives that have all of these skills. So this is just an illustration of how many hats we all need to wear when we're trying to manage a business. Next slide, please.
And similarly, when we're talking about putting together an HR function, there are numerous vendors that go into supporting that function, from the payroll administration service, the HR system, benefits management and broker services, 401ks, workers' comp insurance, even bookkeeping and tax accountant services. So there's just a slew of different services that go into delivering the HR processes. So in the HR outsourcing realm then, one of the advantages of outsourcing is that you then cobble all these services together essentially under one umbrella. So it's like a GPO, function in that the HR outsourcing firms typically will have a significantly higher volume of number of employees, the volume of payroll, the volume of tax, all that, when they go to market and look for vendors that support those activities, they're buying based on a higher volume, similar to what a surgery center or a hospital gets with the GPO service, that economies of scale. The difference is with the GPO, they're talking about, lots of times billions of dollars of purchasing, and the surgery center, the individual surgery center can really go to the same set of, or pick and choose the vendors they want to go to and buy from. So with an HR outsourcing service, it's a little bit different than that, because that HR outsourcing firm is really trying to pull together what they view as the best fit for the service they're trying to deliver. So you're going to, most of the time, not always, but most of the time, have a very, much more limited selection of vendors to choose from. However, you can be assured that that outsourcing vendor will have chosen those sub vendors based upon their fit to your organization or and the skills needed. Next slide, please.
So why outsource? And as Tom just alluded to, there is functionality, there's efficiencies delivered when a company is able to single source a lot of the areas that are encompassed within the human resources capabilities. We're trying to bring a solution that is aligning companies up and sharing risk with a company that provides that outsourcing solution. We're trying to utilize our companies find efficiencies in utilizing the latest in office automation technology. How are you handling the management of your human capital? And that's where providing the infrastructure from the HR side to the technology side to the litany of benefit offerings. It's that single source model and leveraging, as Tom mentioned, the economies of scale that can be brought to a smaller company as compared to a much larger organization. Next slide, please.
So in doing that, as Jay mentioned, delivering those services from a larger platform to the client company, what we find is in smaller companies, surgery centers, doctors' practices, really any smaller business that maybe has 10 to 50 employees, the HR administration duties are typically shared across several people, either the administrator or CEO, in the surgery center situation, the director of nursing, business office manager, even some of the administrative staff, all share in those duties. What we find is that by outsourcing, you can really free up the time from that set of individuals so that they can focus their time on more productive activities, whether that be recruiting physicians or contracting, negotiating better payer contracts, or even supplies contracts. Things that really are more closely aligned with the core competency of the surgery center. The senior managers can focus on those things by outsourcing some of these other administrative duties to an HR outsourcing firm. Next slide, please.
And this is just an example of a surgery center, typical surgery center, that is utilizing an outsourced solution for human resources, where hopefully that outsourced solution is reducing risk and expense, and along those lines, increasing overall productivity. So if you take a $5 million center and you're able to save 5% on the bottom line, that's a $250,000 realized savings on an annual basis. And I think that happens in a lot of cases because the management of said surgery center is able to work on their business and not necessarily in their business. So they're working within their core competencies and helping that business succeed and thrive. Next slide, please.
So bringing it back to the challenges the typical surgery center is facing, and just kind of shining a brighter light on that point. The surgery centers succeed, of course, we all know, because they have case volume, and the case volume matches up to the equipment and the staff and the processes that you have in place. Again, the more organizations are maybe distracted by important issues. I mean, the people issues are generally very, very important and very, very get the right attention from the senior management of a surgery center. But the more quickly you can deal with those things by having a partner that really is seeing, an employee behavior issue, let's say, that maybe comes up in your facilities a few times a year. Well, the HR outsourcing firm, you've typically seen that same type of circumstance many dozens of times throughout the year, for example. So again, best practices and dealing with things in just a more effective and a professional manner, and really taking getting the responsibility off the shoulders of the senior manager as quickly as possible can really lead to the growth and case volume and the other things that are important in the surgery center. Next slide, please.
Yeah, so to expound upon some of the things Tom was just speaking to, we did poll ASC managers around the country over the course of about a 2-year period, and the poll centered around what some of their main concerns were within their organization on a daily basis, monthly, annual basis. What comes up the most? And you'll see that 58% of the surveyed managers said employee disciplinary issues are their biggest concern. And as Tom mentioned, it is how you deal with them. And going back to an outsourced solution should know best practices. They should have come across these issues several times over, as opposed to not really knowing exactly which direction you want to go with said issue. And then close to that, 26% said employee benefits issues. Again, there should be capabilities within the outsourced provider that would be able to advise on employee benefit issues, advise on workers' compensation issues, policy advice. All of these are noted issues that have been brought up by the managers, and that's what you should be looking for, is having that expertise and using it almost as a security blanket in a lot of cases, just having peace of mind. I mean, that goes a long way. Next slide, please. And so just to continue along this path, the handling of the employee discipline, but being proactive on benefits management and risk control, controlling labor costs, which I know is a big concern in ASCs around the country. Again, that compliance thing always comes up. There's so many areas of compliance that it's very, very hard for one person to maintain that level of needed compliance, and that's what we're looking at. It's the best practices. Training managers, training promotions, making sure that I like to use it. How are you hiring are the right butts in the right seats? If we could take your C players and make them D players, and D players and turn them into A players, what kind of positive effect would that have on your organization?
And one other thing, one other thing on this, just real quick. I want to point out the automation piece. All healthcare providers these days have either spent or are spending money on IT systems and software solutions to get more automation in their facilities. We all see this as the potential of this, even though maybe right now or recently, it hasn't produced much in terms of cost savings. With an HR outsourcing firm too, and other types of outsourcing, whether it's revenue cycle or whatever, those vendors, the HR outsourcing vendors, bring with them software technology solutions. And so one benefit, other than the obvious, that that automates your processes, is that you don't need to spend your precious capital on those systems. They're already built, they're already set up, they're already being run by experts. You simply need to tap into it. And so it's a real benefit that HR outsourcing and other types of outsourcing firms can bring to your facility. Next slide, please. So this is a kind of a cause and effect example, and you know, we all know if especially first case of the day, if that starts late, it gets everything off on the wrong track and causes all sorts of problems. Well, if it's you know, there are various reasons why a case may start late, whether maybe sometimes the doctor has an emergency and they need to respond to, maybe it's communication, maybe it's employee performance issue. And so this is just, again, driving home the point that the quicker you can have best practices applied to a behavior situation, employee performance situation, and correct that situation, you know, the more effective you're going to be in your overall operations. Next slide, please. So just to get to the cost, we all know there's a cost, and this is kind of a I guess a way of thinking about those costs. We have, in the case of this late start and maybe an employee behavior issue or performance issue that caused it, well, the rest of the team has to compensate. There's a cost to that. There's a management attention that's distracted from the more productive activities, as we talked earlier. There's obviously just the reduced productivity, you know, the straightforward, that's a direct cost. And then the other problems, which is, you know, poor physician satisfaction or patient satisfaction. And we know how important that is with value-based purchasing coming upon us. So again, it's just kind of hitting home the point that more effective HR management can lead to better performance. Next slide, please.
So HR is our front office. So what you should expect from an outsourced human resources solution is the capabilities, the functionality that comes along with them. So most businesses, labor is their biggest line item, 30 to 40% of their annual revenue on average. With this being such a critical piece of the line item, it needs to be managed. How are you currently managing your human capital? Can you manage it better? You probably have somebody that's in charge of managing your materials, but most companies don't have somebody that is specifically involved with management of the human capital. So HR has become very convoluted. It stretches across a lot of different areas, you know, from workers' comp to benefits to employee relations to compliance to federal and state tax laws, and the laws, rules, regulations. You know, back in the mid-30s, 1930s, there weren't that many laws that you had to adhere to. Now there are hundreds of laws that you have to adhere to, and there's probably I mean, I think this is a conservative number, but 150 separate tasks that a human resources manager needs to be able to handle on average. And if you're stuck doing this by yourself, you're probably losing money. There's probably more efficient ways to do it. There's probably better expertise out there that you can leverage to help manage your business and drive additional revenue. Next slide, please.
So this gets into, you know, after we worry about what are the things that keep the manager up at night in that previous bar slide earlier, now this is, you know, what is the frequency of need? Benefits issues and payroll are the highest volume frequencies of need, but those things of the 150 tasks that Jay just mentioned or alluded to, you know, there's probably a few dozen just wrapped up in payroll and benefits, as we all know. So again, just kind of making those as efficient as possible through automation, through best practices and processes is something you should expect from a outsourcing vendor. Next slide, please.
So this optimizing comp and benefits, you know, piggybacking again on Tom, you know, compensation. There is a wide gap between surgery centers around the country on what they consider is an average range for compensation. A good, capable HR partner, an outsourced solution partner, will be able to advise on compensation strategies, and will be able to provide fair market value feedback to that organization to help you attract and retain key talent, because we all want the best talent, but there's a lot of companies in a small region that is competing for the same talent. So how are you going to attract and retain? And that is key when it comes to the management of your facility and how how profitable it's going to be. When it comes to benefits, how are you tracking your premiums on an annual basis? Most companies are seeing a rise in premium, even with the Affordable Care Act. So again, a partner in human resources with you should be able to help you analyze what is your loss ratio on your medical benefits. They're going to help you evaluate the insurers and the programs that are out there. There might be a better fit for you and your organization or your employees, based on location, based on the types of employees you have on staff. There's a lot of the companies out there are going to be able to provide guidance on ancillary benefits. So, hey, maybe we want to start a tuition reimbursement program. Maybe we want to start a program where you can bank your PTO days and give them to another coworker that maybe falls ill and has been out of the office for a while. There's a lot of technology that goes into this, but obviously the provider that you've partnered with should be able to accommodate that. Next slide, please.
So now we're going to get into some examples of specific examples of best practices and really how that can benefit your surgery center. The ASC Association just came out with a great set of data looking at salaries in the various markets. I think there's probably a report that you could generate one for every state. Gets down to that level. We think that's a great resource, but the way that can be applied in even a more best practices manner is to take a look at your jobs and who's doing your jobs and how they line up with, if you have a OR nurse, well, how do you compensate an OR nurse who's also maybe your infection control representative? Those sorts of things. So how do you factor in pay variations based on those types of differences? That'd be one area where you can kind of take it to the next level. Second thing is, how do you then manage, once you have these salaries and salary levels for every position, how do you manage that? Well, an HR system from a HR outsourcing firm is going to have the capability to put in job bands and salary bands with minimums, 25th percentile, medians, 75th percentile, etc., and really apply that to every individual and make sure that there's consistency in approach in terms of how people are compensated. We'll get into some of the examples of recent laws that have come up, but more and more the federal government is looking at fair pay. And what they mean by fair pay is, why is this person being paid more than that person? What's the justification for that? The more you have in terms of documentation and the more your processes are geared toward managing those things going forward, the safer you are, so to speak, in terms of not getting a fine or whatever by the Department of Labor for practices that maybe aren't where they need to be. Next slide, please.
So going back to the health plan, and I just spoke to this a couple of slides ago, but costs are rising. It's no secret to hopefully anybody on the webinar here. But what is affecting the rise in healthcare costs nowadays? I like to look at the middle box. A lot of it is claims incurred. This is a variable cost, and it is variable cost that is impacted by the participants. So how is that managed? How is that being managed on the back end? How can we control claims? A lot of employees don't know how to use their health plan appropriately. They may be getting services that are not needed. They might, let's just take a wellness plan. If you implement a wellness plan, and a proactive wellness plan at that, that can help drive down claims that are incurred over time. It's not going to happen overnight. In fact, claims a lot of times will go up in the beginning of a well-run wellness plan, and they should, because they're getting treatment for things that they currently have, but that is going to mitigate the bigger risk further down the road. So some of the other areas, administrative expense, reserves, some of these are fixed costs, so there isn't as much control. But this is just a diagram to just kind of highlight where things are going in the healthcare field, in the medical benefit field, to combat the rising costs that is passed on to the participants as well as the business. Next slide, please.
Again, going to that best practices, and most surgery centers are in the small group market, and there's basically zero transparency in terms of what happens in your health plan and what is driving your costs. And even such basic things as our employees getting access to the network and the care they need through the network. A lot of these questions kind of go, there's such a non-transparent situation that it frustrates a lot of business owners and business leaders that expect to have information at their disposal to look at, judge, assess what's going on, make decisions, and take actions to improve a situation. The health plan, as a large line item as it is in your expenses, it's incredible how little control you really have over it. Well, again, next level of best practices with an HR outsourcing firm, they will have information at their disposal that will help you in partnership, see what's going on in your surgery center and in your, not on an individual level, but on the group level. What are the needs of your facility in terms of delivering a health plan to your employees, and where are the strengths and where are the weaknesses, and then you can take action, make decisions to improve it. Next slide, please. So as Jay mentioned, a wellness activity or wellness program. Again, it's that next level of capability when you have an HR outsourcing firm. To build a wellness plan and to really make it run, it takes quite a bit of effort. And not only that, there are tried and true methods versus things that have been tried and did not work out. So you want to go with a firm that has experience in wellness and setting up a good plan. You don't want to do every idea out there. However, you do want to engage staff. So there's a balance, but having a well-run wellness program can not only impact the cost of your health plan, but it can also just create engagement and productivity enhancements in your surgery center by having a more engaged staff. Next slide, please.
So automation.
Yeah, go ahead.
Go ahead, Deb.
All right, I'll take that. So automation and measurement, what we're talking about here, again, getting that next level of capability is the IT system that can automate various things like PTO requests. It's one of the first things we usually do when we get involved in a situation, and it's also one of the I guess the areas that we always get feedback that, hey, that's a much better situation. We're now automating that process of tracking that information versus maybe a spreadsheet and sticky note combination. So, an HR system ought to be able to have automated alerts that remind people when their nurse licensing certification is coming due, and send an email to that person with a link to the State Department of Health form that needs to be downloaded and filled out to update the credential. All these sorts of things can be automated by a good HR system. Next slide, please. And this just highlights some of the things that you can also do with the HRIS. You can put your employee records online and organize your files much better. Again, as I mentioned, tags things with a date to you can have an alert built on that date. Of course, AAAHC, Joint Commission, reviewers, inspectors, they are bought into these systems. They're certainly bought into them on the electronic medical record side, so they certainly see the benefit and usefulness on the HR side as well. So we've been through many surveys where we've had the online employee record, and actually most surveyors really like it a lot. Next slide, please. And one last
keep rolling, Tom.
All right. I'm on a roll here. So training and mentoring, again, this is more of a how a HR service should be designed specifically for your facilities. Of course, in healthcare, we know that you're maybe, a well-performing or great-performing RN might become the charge nurse, might become the director of nursing, might become the administrator. Typical progression. Many times, though, maybe didn't have formal training to go with, simple things, how to conduct a meeting, how to administer discipline, all these, so HR outsourcing firm can help you design the specific training that's going to meet the needs of your situation. You should be able to bring to your facility also clinical training, even or one-off training, like we've been asked to, unfortunately, I guess in one way, we've been asked a lot to do bullying training sessions. What is bullying and how to prevent it and how to overcome those situations in the surgery centers. So a training program from your firm should also be customized to your situation. Next slide, please.
And this is just an example of what Tom was speaking to as far as manager and supervisor training. As he alluded to, if you take one of your best nurses and that person is promoted to the head of nursing, but probably or maybe has had no experience managing employees underneath them, there's courses that should be your outsourced partner should be able to put together a program for and work people across all areas of your organization, put them through training programs that is going to help them become more effective. And the HRIS, that platform, should be able to monitor and maintain records of who has completed what course, and you can set grading on each course, and you have to hit a certain mark in order to pass on to the next one. So not only is it training employees to become better managers and supervisors, but it's also providing career path development. And going back to that previous slide, cross training, that becomes important within an organization, and it does cut down on turnover. Not all turnover is bad, mind you, but it does it does counter the bad turnover, for lack of better words. Next slide, please. So, this is one I like because it kind of smacks you in the face a little bit. And this is a very, very conservative estimate. I always like to err on the side of being conservative when I throw things like these out there. But there's some companies out there that say, hey, the cost of replacing an employee is 100% of said employee's salary. I don't think it's necessarily that high, but when it comes to all the training you put in for that employee that has left your organization, the cost of possibly administering COBRA benefits, paying potentially state unemployment out to that individual, that is going to affect your your annual rate from your state. Then you have to spend time in recruiting the next employee, and then you have to spend time training that employee. And so, I mean, the very conservative estimate is 12 weeks of productivity, and you can monetize that. You can quantify that into how does that affect your bottom line, and it's a big number. It's a big number. Next slide, please.
So another best practice is behavior-based interviewing. I'm sure most have heard of that phrase, but your HR partner should be able to train your staff and to help you organize how you're going to administer your recruiting and interviewing processes, so that we like to see peer-based interviewing, for example. We like to see that the administrator, the managers of your facilities are in charge of the recruiting and interviewing process, but you engage maybe some of your A players to be a part of that process to help them identify, maybe if you've narrowed it down to 2 or 3 candidates, help your team identify who of the 2 or 3 candidates is your best hire. But not only be part of the interview, but have been trained on what kinds of questions are good questions, what kind of questions you want to stay away from. And your HR partner should be able to help you do that. Next slide, please.
It always makes me laugh when we talk about recruiting and interviewing, because you would think a lot of it is common sense, but the stories that I have heard over the years, it is just mind-boggling what some people will ask in an interview. But this is kind of a snapshot of part of the HRIS, that platform. This is the piece of the applicant tracking piece where you can list jobs. You should be able to list your current job openings. You should have people should be able to apply online. It should throw these job listings out on any job board that it's free, that you want to pay for. It should automate that process, and then it should also automate the process of receiving and evaluating the resumes and moving each candidate through the interview process up to the stage of hiring, and then roll that into the payroll module, and it makes it a very efficient, seamless process. So this is just an example of something like that. Next slide, please.
So as Jay mentioned earlier on in the discussion, how in the past, maybe in the 50 years ago or whatever, there weren't nearly as many employment laws. What was in place then, there was a lot greater union participation, and that's really declined. Next slide, please. What's kind of supplanted the union involvement maybe is that the local, state, and federal governments have really gotten involved to regulate employers more. And so some of this is good, honest employee protection kinds of things. Still, though, the employer is now on the hook to make sure that they're complying with these things. Other things are just overly complex, and we all could probably envision easier, smarter ways to do it. But nonetheless, these things are in place, and so correctly complying with those are very important. Next slide, please.
So continuing along that same path, the Fair Labor Standards Act, the Department of Labor, there is a change in law coming out next year, and it's going to change the definition of exempt versus non-exempt employees. I think right now it's set at about $25,000 annual pay, and it's going to move to probably close to double that, $49,000, $50,000. Well, that's going to open up a can of worms across all companies. This isn't specific to ASCs. It's open to everybody. So as Tom and I were discussing the other day with a client of ours, it's going to raise questions as to, okay, I have a manager that's making $40,000 a year, and they're currently exempt. Well, now that manager is going to be eligible for overtime. What's going to happen when the manager is at home and answering emails and on the cell phone? Are they going to have to be compensated for that time? Whereas in the past, if they were an exempt employee, there wouldn't be those issues. Jumping down to the pension plan fiduciary, there's a lot of law change here. There's the government is fighting for transparency in this area. As employers, we all have fiduciary responsibilities to our human capital, whether it be on the pension, the 401k side, whether it be on the compliance side, whether it be on the benefits side. We just have to be aware. Let's take 401k. How much are the how much are the fees associated with the plan? Are they accessible? So can I, as an employee, go and see how much of my dollars that I'm putting in is going back into somebody else's pocket? Well, because of these law changes, the DOL is coming in and they're auditing a lot of these plans, and it is there's a lot of heavy fines being levied against a lot of employers because they don't have the proper transparency. They don't know what they don't know, so a lot of times it's not their fault, but it could be the partner for the 401k, or it could be their TPA that is really kind of bleeding them dry, and it's usually right out of the participants' pockets. So just another area of law change that is affecting all employers.
A few other areas then also, the Affordable Care Act, we all experience it on the provider side, and and what we're dealing with there on the health insurance side. For an employer with a health insurance plan, of course, we have to make a decision: are we going to offer a plan or not, or be subject to fines or not? But even still, every employer is required to basically do the belly button count and every month, and understand who's a full-time employee, who's a part-time employee, be able to count up total hours to figure out your FTE equivalent. And there's a couple of new IRS reports that need to be filed on a regular basis to do that. On ADA and FMLA overlap, it probably started about, from our experience, maybe 4 years ago. We kind of got caught on one where it used to be you could say FMLA, it's 12 weeks, right, of total time. However, if there's an injury or some maybe ADA type thing, you had to extend. There was a process. It was kind of well known what the guidelines were to how much additional time you need to extend in order to accommodate that. To know whether that person was going to come back or not. Now it's much. The picture is not nearly as clear. The government has decided to be much more to look at every situation as it's a little bit more on its own, to be a little less opaque about what those rules are. So we have to now really assess every situation on its own merits for that ADA and FMLA overlap. And lastly, this end of August, the National Labor Relations Board had a ruling about Browning Ferris, which is a recycling vendor, I think, out in California is where this facility was, and they had a staffing firm that was providing staff to that facility, and it opened up a can of worms in terms of they decided to say the staffing firm is not the sole employer; it's now a joint employment situation. Because of the nature of the ruling, it really opens up a lot of questions across all industries about how the NLRB is going to look at who the employer is, and when it comes to collective bargaining agreements, who's the entity that employees are going to be bargaining with. And so there's a lot of joint ventures in healthcare. There's a lot of joint ventures and various arrangements between parties, and essentially anybody who's directing anything about an employment situation is now, according to NLRB anyway, that labor and collective bargaining perspective anyway, can possibly be considered an employer and therefore possibly can be considered one of the parties that is subject to a labor negotiation. So that's a brand new one. There's a lot of questions about how that's going to play out. But again, this whole list of things is simply painting the picture again, just how complex things are getting, and it's just very tough to have one individual, or imagine one individual in a small business being able to handle all these issues. Next slide, please.
So, and again, over the course of a 2-year period, we did a look back, and we looked and asked, and I guess ascertained what the employer's risk profile actually looked like. And you can look around the wheel, and unemployment, discrimination, attendance, a lot of the FMLA ADA compliance issues, work environment, inappropriate behavior, involuntary term. All of these are what we call the risk profile of a typical business, including ASCs, and that is what a company that is a professional in the outsourcing of human resources. These are the areas that we're, companies like us, we can come in and positively affect. So it's just kind of one of the last examples that we're going to show you today. Next slide, please.
And just putting numbers to that, that's the other thing about it is the HR generalist who handles these issues every day can understand which are the higher risk issues and which are the less risk issues and prioritize accordingly. They're all important. We want to, again, optimize and use best practices across the board, but still, there are time pressures, there are circumstances where prioritization is required, and so just to, again, put the perspective on it that HR professional will understand that and help you guide through those situations, and also when it comes to, let's say, a negotiation, kind of know where the mark is, that, given the situation. It's all very much driven by the situation, but has the experience to know what is the most appropriate place to be on a negotiation. Next slide, please. So again, we're kind of in summary. We think there's a significant opportunity for reducing cost, reducing risk, improving productivity by applying best practices to your people and the process and the support and the needs that people in your organizations have. And there's so much complexity in the employment market these days. Obviously we're in this business, so we're true believers, but we think there are certainly improvements that can be made, and it really does all flow to the bottom line when you have these best practices applied to your facilities. And with that, we will open it up for questions.
Thank you, Tom and Jay, for a very informative presentation. We will now begin the Q&A portion of the program. As a reminder, you can submit any questions you have by typing them into your control panel in the space labeled Enter a Question for Staff and clicking Send. Our presenters will attempt to answer as many questions as they can during the time we have for Q&A, and will follow up on questions they do not have the opportunity to address. See, we do have a few questions ready here. First off, at what number of employees do you recommend keeping HR in-house versus outsourcing?
Well, I'll start with an answer, and Jay, jump in if you think of anything else. But number one, I'll just say, of course, it depends upon your situation. If I'll just start with that. But around that 10 employee mark is when we see most firms start to think about it. But I say it depends upon your situation, because there could be reasons where under 10 is sometimes appropriate. But the more people, so as you get to the 20 to 30, 50, those ranges, you have more and more people kind of interacting with one another, and that's where just the complexity as you get, you know, above that 10 mark or 15 or so is where we start to see it making sense. But for even a smaller group, the economies of scale can really potentially be a driver in and of itself as to why you may want to look at outsourcing.
Yeah, and I'll just add, as Tom said, that there's key milestones from a size perspective. There's 10. You have to adhere to most of the laws. 20, you have to adhere to about 90% of them. And then at 50, you might as well be 50,000 employees because you gotta deal with everything that's out there. So I think 10 is that critical number. You'd have to, in my opinion, you have to get to over 300 employees before you can look at bringing HR back in-house. That's just my opinion, because then you start to generate your own economies of scale, if you will. But that's my opinion.
Absolutely. And the next question is, what are you looking at as far as the average cost?
Well, one thing about it is, again, a benefit of HR outsourcing is you can really, the cost will be lower the smaller you are. It'll be higher as you grow. So what that means is the firms usually price it some variation or some manner in which the fee changes with the number of employees, whether that's a fee based on percentage of wages or a fee based on a per employee per month kind of arrangement. So it depends upon the size. But it's not until you get to a fairly large surgery center where you're going to be, spending the equivalent of an HR director or something like that. So you can really, I think you can get a good value out of this as well.
Absolutely.
Well, and if you look at the per employee per month model, which is the one that I think fits best for most companies, you have that cost, which is going to be much less than you would pay a full-time HR administrator, for that matter, let alone a director. But then you look at all the potential cost offsets. Maybe the outsourced firm can bring in a more competitive benefit program, right, cost-wise as well as offering-wise, or maybe a lower-cost 401k, or maybe leverage savings through state unemployment arbitrage or workers' compensation premiums. There's other areas that offset just the cost that everybody looks at. So I don't think this model would be as popular as it is if we couldn't leverage those economies and help offset costs in other areas, while also driving down the operational cost of managing their employees.
Absolutely. And the next question is, what's a typical timeline for implementing MedHQ services?
Well, we like to have 45 to 60 days, and I think that's probably consistent for most HR vendors. There's a lot of things that go into implementation. First and foremost, and what gets a lot of focus up front is making sure that first pay period is done absolutely correctly. Understanding that the first rule of HR is don't mess with the paycheck. So that's first and foremost. But there are a number of other things that need to be set up. These vendors we mentioned early on in the presentation, all those vendors basically need to be brought in and notified of this new location, new set of employees that need to be cared for. So there's a number of things that go into that, but somewhere in the 45 to 60 day time frame is usually ideal.
Excellent. Well, I would like to thank our presenters again for the excellent presentation, and all of you for participating today. We're looking forward to having you join us for our future webinars. This concludes today's program. Have a wonderful afternoon.